You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for dental implants? According to my first guest, he says no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have Irvine's dentist, Dr. Joshi. Dr. Joshi, welcome to the program.
Thank you. It's a pleasure being here.
Now, before we get into today's topic, for those that don't know you, tell me a little bit about your practice. Who's your typical patient? What are the different procedures you do? And I also understand you work, I've met your wife is also a dentist.
Yes. Yeah, we do work together, and we work pretty well together, actually.
Okay.
As far as our practice is concerned, we don't really have a typical patient because, we have patients that are ranging from the age of 2 to as much as 90 years old and plus.
Okay.
And, we see patients who are young that have lost a single tooth due to accidents and need that to be replaced with a single implant, to someone who is in their 40s and 50s and 60s who have lost several teeth due to bad dental decay and they need those to be replaced, to someone who are in their late 80s, 90s, and 70s who actually need a bunch of teeth to be replaced. All of them are gone because of advanced gum disease.
So you do more than just dental implants. You do like fillings and just all the standard stuff.
Yes, Randy. We do everything in the dental world, and
Okay.
basically, we do restorations, which are fillings, the white fillings. We do a lot of cosmetic dentistry. We do veneers. We do lumineers. We do minimal prep veneers. We do Invisalign, depending on cases. We're also having a wonderful laser program in our practice to
Okay.
help people out with their gum disease and also to get better surgical outcomes. We also provide sleep dentistry for our patients, such as oral conscious sedation. We always feel that it's best to be on top of the dental field, so to getting
Okay.
the best products out there for our
Now, does your wife do certain things that you don't do? Or do you reserve certain things in the practice?
Yeah, she loves to see kids.
Okay.
She is really great with dentures, making the dentures.
Do you make cosmetic dentures in your practice?
Oh, yes. And, we are working with one of the leading companies that makes something called a snap-on denture, basically. It's a
Okay.
snap-on smile. You just basically, it covers up your teeth, and it covers and replaces the missing teeth. And it's an amazing way of a temporary fix for someone who's
Like
wanting
you're
to.
going out for the weekend or whatever?
Oh, yes.
It snaps right over your teeth.
Just snaps right over your teeth. None of your tooth structure needs to be touched up on.
Okay. Now, by the way, do more people like going to a female dentist than a guy? Because everybody's afraid of the dentist, right?
Yeah,
Nobody wants to go to the dentist.
Yeah, unfortunately, we're in a profession that has always been thought of it as with a lot of pain involved, and it can be farther from the truth nowadays.
Okay.
Because we've evolved. We've seen what our weaknesses are in our profession. We want to take away the pain factor, and once you take away the pain factor, the anxiety level goes down, and once that goes down, we can actually accomplish things for people.
So let's begin with the different categories of dental implant patients that you see.
Sure. We have patients with a single tooth that's missing, to someone who's having 2 or 3 teeth that are missing in a certain area, to someone who needs to they need to have all of their teeth taken out because of advanced gum disease.
Okay.
And with the people that have dentures, those are the ones that have lost all their teeth, unfortunately. There's also a couple of categories involved with that too. The first category is someone who just recently got dentures within like the last 5 to 7 years, and they're struggling to just trying to keep up with it because they're not fitting properly.
Okay.
To someone who has dentures for many, many years, and they've been wearing these dentures and they've had many other issues because a lot of their bone underneath the denture, what holds that denture, has
Okay.
been lost.
Okay. Isn't it true, though, that if you've been in dentures 20 years, that you may not have enough bone to get dental implants? It's true? Not true?
No, not
Okay.
true. Not true. This is one of the most common misconceptions most people hear, that I don't have enough bone, Dr. Joshi, can I get dental implants? And I feel that there are so many different options out there for patients they don't even know about. For example, the bone issue only comes into play when there's a severe case. And by the way, these severe cases are a very minor population that we're dealing with. Most of the patients don't even know what their options are.
What about pain, though? I mean, if you're 80, 90, denture wear, did the dental implants fall out?
No.
Okay.
I
Is this a question they want to know, by the way? Because it seems like very painful, and if you're older, they're going to fall out.
First of all, with implants, there is no pain. And you know, the reason why there's no pain is because we're actually placing a dental implant into the bone. And Randy, there are no nerves in the bone area.
Okay.
I'm sure you might have a large nerve, you know, but we overcome that because we actually do advanced imaging to figure this out. This is all part of the planning.
So the bone itself doesn't really feel the pain?
No, the bone itself is like a sponge. How can it feel pain if there's no nerves around it?
So pain isn't something they complain about?
Pain is one of the last things that they complain
But is that
about.
their number one fear?
It is their number one fear before they walk into that door, that, oh my gosh, I'm going to have dental pain when I do this.
Is that right?
Yeah.
And okay, so the denture wear. So when I'm told, like I think I told you, my mother was told by her medical doctor at 74, you're too old for dental implants. Probably not the case.
No, it's not the case. You know, I've been in lectures, I talk to my colleagues, I talk to my super specialist that I've worked with, and we actually see cases of 90, even 100-year-old people going through dental implants.
But why would a 100-year-old want to do this?
Randy, they want to eat and chew.
Okay.
Can you imagine eating your food and eating in such a way that it needs to be blended up because you can't chew the right steak, or you can't eat the corn on the cob, or you can't eat the fresh fruits and vegetables that you need for your fiber in your body, and live a quality of life that you're trying to live?
How big of a problem? I mean, how many people wearing dentures, by the way? Because I mean, I don't notice dentures. I don't know how big of a problem it is.
It is
A lot of people with them?
Randy, it's a huge problem. Nobel, which is one of the leading companies, Nobel Biocare in dental implants, leader of dental implant industry. And they're the ones who are saying there's about 40 million people with missing teeth, top and bottom. They have top and bottom dentures.
So in Irvine, tens of thousands, possibly.
Oh, yes. And the sad thing is, it really does not have to be this way. You know, they can actually change something, and they could change those dentures and make them a little bit more permanent, so where they could chew properly and they could have a quality of life.
Okay, so what if it's as good as you say it is? Okay, and if there's so many, you know, what about like LA County alone and Orange County, close to 500,000 people probably wearing an upper or lower denture?
Easily.
Okay. If it's so good though, dental implants, and you say with 2 implants you could snap in, snap out, why aren't they all doing it? What's your take on that?
The biggest reasons why they're not doing it is, number one, it's involving a lot of pain. And just like I mentioned earlier, dental implants go in a bone area, and there's no nerves associated with the bone, minus the big nerves, which are already, we figured out before we do the procedure. Second thing is the fees. Everybody counts their teeth and go like, okay, well, I'm missing all these teeth, so I need to have a dental implant for each tooth. Well, that could be farther from the truth.
Okay.
You know, as we know, our dental technology has advanced in the last 15 years. So we can actually get more, with less dental implants, we could get more teeth placed on top of them. Number 3 is they don't go to the dentist anymore. Now that they have
Good point.
Yeah, because they have a set of dentures. So they feel like, what's the purpose of going to a dentist? I have no teeth. What do I need to go to a dentist for? So if they don't go to a dentist, they're never given their options. And by the way, when they do go to a dentist, a lot of times they're prejudged. They're prejudged by the dentist or by other people because the fact that this person has dentures, well, they're pretty much comfortable with it. And the question or the conversation of how bad their denture wearing is going on is never brought about. And therefore, they're just ignored. The subjects are ignored. And I really think it's sad, but you know, we need to change that. That's why I'm here today. And on top of it all, Randy, the last thing they start thinking is, I'm too old for this. And that could be...
So they count themselves out?
They count themselves out. Before they even go in for an opinion or an options that they might have, they basically write themselves out of that.
So now, why is it, and I have a lot of questions about, you know, for the denture wearers, but why is it what used to take, I guess, 6 months to get dental implants, the process now can happen in a visit or 2? What's shorten the process?
Sure, let's talk about that. You know, everything changes in given amount of time. I mean, we see our computer technology changing in like 5 years. So we're talking about 15 years, dentistry and dental implant specifically, dental implants, they've changed drastically. You know, we have better dental implants, meaning in the sense that we have dental implants which have better surfaces. So they can adapt to the bone. They can anchor onto that bone quickly than it used to do before. Secondly, we have found out, because we have done so many of these dental implants, how to figure out exactly where to place them. And one of the tools that's really helped us out is CT technology. We have actually gone away from those olden days of using those dental x-rays to now we just sit down in a quick 10 seconds, we take a little scan of your whole mouth, your jaw, your skull, everything, and we figure out exactly where your good bone lies. And because we know where your good bone lies, we know exactly how to place them. See, in the old days, we had to do big invasive procedures.
Surgical procedures.
Big invasive surgical procedures. But not to say that they don't need to be done now, but they could be done with more precision nowadays, and they don't have to be opened up so much.
What do you mean opened up? You mean the gums?
The gums.
So there was more cutting of the gums.
There was a lot more cutting of the gums, and that took...
That hurt.
That hurt. Exactly. Exactly.
Interesting.
And, we also figured out we could give better medications nowadays, too, for patients to counteract, even if they need to have that kind of procedure done.
Okay, so let's go over the options then. Okay, so we're talking about no more dentures, get a fixed set of teeth in just a few appointments. We're here with Dr. Joshi. You are Irvine's, Orange County's implant dentist.
That's right.
So what are the options from the basic option for denture wearers to, I guess, the best thing you have available?
All right, let's go through this. All right, so this is a denture that we have right here on the model. And basically, I'm going to try to take this out. By the way, it's so snug fit that it's taking me a couple seconds to just take this out. This is basically the denture, and you can see that there are two implants.
So it's two implants where?
Two implants on the bottom jaw. On the bottom jaw, exactly. Right. Yeah, closer to your cuspid areas of your bottom jaw, if you had to sort of tell where it might be. And you could just see that they're...
Here, hold that up for a second so the camera... So
sure.
That's like a denture, but it has holes in it.
That's right.
This snap.
Exactly. We call it snap in and snap out dentures, basically.
Okay.
And we basically have two little holes right here, and they go straight in.
Let me check this out.
This model.
So this is accurate. This is a real...
Yes.
Okay, because it looked like you were... And I'm not exaggerating here. I guess my hands are a little bit greasy. So could it be too snug where people can't get it out of their mouth?
Oh, yeah. I've actually had complaints about that.
Okay.
And which is a good thing, by the way.
A trick to this, but so two right there. So snap in, snap out.
Yes.
And you're saying it's not really painful to get this done.
It's not painful.
It does seem painful. I keep bringing it up, but it's not something they complain about.
It's really not that bad because we plan everything. We plan exactly where these implants are going to be placed, and we give you the proper medications, and we make sure you're comfortable. And we like to do this with minimal invasive approach if we can. Okay. And the result is an amazing outcome with less pain, because remember, this is going into the bone. It's not going...
Are they ever without teeth? So if a denture wearer is watching this and they do this procedure, the two implants for a snap, full arch of teeth.
Yes.
How soon could they eat?
Well,
is a question.
They can start eating within, in the beginning, obviously, you have to give it some time to heal up. But what is this time? Basically, it takes a few days to eat soft foods. We're given, like the first day, you're going to be on a liquid diet, which most of us can adapt to. Within the next couple days, you're going to move over to soft foods. And,
all right.
When we say few days, we're talking about 4 or 5 days. From that point on, you could start having a little bit of semi-soft foods that you can start eating, and within a week or 2 weeks, you're back to normal. And in fact, you're even better than back to normal, because now you can start eating things that you couldn't eat before.
What about people that are watching this, denture wearers? And I know one that admits it. Okay,
Yeah.
And they say, my lower denture's fine. Is this better than the tightest, snuggest lower denture to get two implants?
Sure, Randy. Let's just talk about it. It took me just a couple seconds to get this model out.
Okay.
And if we were to have an actual patient here, you could see that it would take just a few seconds to take this out.
So it's pretty snug.
It's snug. In fact, our biggest concern that we have with these models and these snap-on dentures that we're doing for our patients is the fact that, can we make sure it's not too snug for them that they can take it out? Because sometimes it becomes so snug that they're having a hard time even taking it out.
Yeah, because if you're 70 or 80 or whatever,
Yes.
even though 70 is young in Orange County,
Oh, yeah.
you may have a little arthritis or problems.
Exactly.
So you can loosen it up.
Exactly.
Okay.
You can loosen it up, and you could cater it to them. And basically, over time, you can get educated properly in how to take care and the maintaining this.
I like what you said. You said, Randy, if there was we were talking in the green room, that if there was a try-in period, even though it's not possible, they said, hey, come in, denture wearers, just to try it for the weekend.
Yes.
Just, a couple of implants. You're saying nobody could go back on Monday.
No. And it's so easy to say no, because the fact is, their denture is not going to be moving.
All right.
And
Okay.
and that's the purpose of what we're trying to accomplish. No more loose teeth.
You know, and people need to know this is a real interview. We're talking about No More Dentures with Dr. Joshi. He's Irvine's dental implant dentist. And this isn't an endorsement for you. I'm just asking the question. My dad, though, we've talked, 78 years old, trumpet player. You're not his dentist, but he got 2 implants, okay, after hearing about this. Snap in, snap out. Loves it.
Yeah.
And he said, too, didn't hurt. But he was deathly afraid of pain, he said. He said, I wasn't going to tell you, Randy, but I was so afraid.
And that's one of the common misconceptions most of us have is dental implants equals pain. And it couldn't be farther from the truth. You know, let me back up to a moment just earlier that you asked me.
Okay.
Why isn't everybody doing this if this is such a great thing that's out there for denture wearers? And, you know, one of the biggest reasons is they've had this fear because by the time they lost their teeth, they already went through so much pain and so much challenges of having all their teeth out. Can you imagine going back to the dentist? They're going to think that I'm going to have more pain now.
Okay. So some people are glad to get them out.
Yes, they're glad to have them out, and they're like, I'm never going to go to the dentist again. My problems are solved. Guess what? I just have to live with this ill-fitting denture, and I'm going to live my life like this. There is no other options out there for me.
So pain is not, because after the fact, okay, because dentures are not painful once you have them in. So it doesn't hurt to chew with the dental implants? That's not something you hear as a complaint?
No. In fact, what you hear is, boy, I could chew more now. Why didn't I do this earlier? Those are the things that we normally hear about.
What's the next level up then? Okay, 2 implants.
2 implants.
Snap in, snap out. Full arch of teeth.
Sure. Now let's talk about the upper. You know, you're talking about 4 implants on your top teeth. Now your top teeth, you know, it is the most noticeable area. Now having top teeth dentures and not having any implants underneath them, well, they're definitely going to be moving as you talk in and out of different
But isn't the roof of the mouth? I mean, there's suction.
Oh yeah, there's
Because
suction
I've been
there.
told the upper are good.
Yeah. I mean, you've got gravity that's holding it up in such a way that, you know, you get suction happening from the palate and from the roof of your mouth. But it's only till a certain amount. And, you know, they have to put this goopy gel. They have to be self-conscious when they're smiling sometimes.
All right.
You know, they don't want the dentures to be popping out. I mean, this does happen, you know.
Okay.
And they're so embarrassed when this does happen. And for the upper, you know, our goal is to go for a fixed set of teeth. You don't want your roof of your mouth to be covered.
Okay.
One of the reasons why you don't want your roof of mouth to be covered is you can't enunciate certain things. You know, when you have something, just imagine this. If you eat something and you have a piece of food dislodged on your palate, can you say certain things? I bet
Good
you
point.
can.
Okay.
You know?
Okay.
And you know, one of the things that we would like to do is we like to take this factor away from our denture wearers. We like to make sure that the roof of the mouth is not covered so they don't have more trauma and they could speak properly, you know.
Okay. So the lower denture, to get a fixed set of teeth there, how many implants?
You want to have 4. You want to have 4 implants. And one of the leading companies in dental industry, dental implant industry, Nobel, they actually created such a product called All on 4. And it is what it means. Basically, there are 4 implants that are placed, and they're placed with a specific precision. And
you do this on a computer first.
Oh yes,
is that right?
Oh yeah. You know, we would take a CT scan of your skull, and you know, sounds scary, but it's not. It's a 10-second. You know, you just sit down on a piece of chair, and there will be basically a scanner that will scan your jaw. That's it.
All right.
Then what we would do is we would take that information and we would plan exactly where you have nice bone, where you don't have nice bone. Are you going to be a good candidate? Okay, where are we going to place these implants? Okay, fine. Our goal is to put 4 implants, so we know which specific types of implants.
So a full arch of teeth.
Yes.
Enough stability to eat whatever. I mean, like broccoli.
Al dente.
Yes.
Yes, broccoli, al dente. You know,
meat, whatever. I mean, it doesn't matter.
Yeah, these.
Interesting.
It is amazing. It is amazing to the fact that, you know, people's lives have been transformed by doing this. And what I mean by that is people can chew the right foods. And that is, you know, you and I, Randy, we both know about the connection between the mouth and the body. Okay. But, you know, to everybody else, we're all starting to figure this out, that how much of your body's illnesses are starting with the mouth.
Okay.
And, you know, by ability of not to eat right foods, you know, you're at a higher level of getting diabetes. You're at a higher level risk and level of getting coronary, coronary disease because you're eating processed foods, which lay more and more plaque in your body, not just in your heart, but also by your brain.
So a lot of these denture wearers, you're saying they change their diet to more of like a soft food, mushy kind of a diet.
Yes, they change it to processed foods because they can't eat the actual apple, so they're going to eat applesauce. And guess what? Applesauce has a lot of sugar.
All right.
And applesauce is processed, so all that food has a lot more carbohydrate intake.
Okay. So 4 implants, you get a full arch of teeth. What's the next level up? Because you say you like to put a little bit more.
Yes, I like 6. In fact, I would even like to do even 8 if we can, because guess what? We're going to get a more permanent
So 2 more
fixture.
implants, you get just stronger.
Yes, we get stronger. And guess what? We also changed the quality of the teeth that are on top of these implants. Before, it used to be resin-based, denture-made type of crowns that you're going to have. With more implants, we could actually put porcelain-based crowns, which look phenomenal, which look like real teeth. In fact, they're better than real teeth because guess what? You're not going to have dental pain from them, okay? There is no nerves associated with this. And guess what? You could chew with a lot more forces than you could ever chew.
So 6 implants, a full arch of teeth, and you can get like porcelain veneers kind of teeth on there?
Yes, porcelain crowns, porcelain crowns on these implants. And, we could do implant supported bridges on your top to just patch up everything, and we could get a wonderful result, a long-lasting result in which you would not only have the ability of chewing everything that you're wanting to chew, but you can also properly take care of it too.
Okay, so once you get this fixed set of teeth, how often do they have to go to the dentist? Or they just clean it at home?
No, you should always see your dentist. Even if you got the the snap in, snap out denture, you should always
like
go
every
see
6 months?
Yes, every 6 months.
Okay.
One of the biggest reasons, I'm sorry, I'm going to go on a little side topic, but I really want to tell you, is one of the biggest challenges that I see is people think that, okay, I have no teeth, so why should I go see a dentist? Guess what? Unfortunately, there's so many other illnesses of your mouth that are never properly looked at.
Okay.
And, such as oral cancer, screenings, such as, trauma to your gums and your tissue, such as, your headaches that you might be having, which are related to your jaw skull not chewing properly. These are the things that are never looked at from other medical professions. Because
so do you think the denture wearers that are watching this, they should at least go in and get evaluated?
Yes.
Does it cost money for a consultation with you?
No.
Okay, so it's a free consultation.
Yeah, it's a free consultation. You come in, I will tell you what's going on, and see if you're going to be a candidate or not. And most importantly, you need to know what your options are so you can be better off, so you can actually do things and be happy with it.
And one of the things we haven't talked about at all is your training.
Yes.
I guess after dental school, what's your training in regard to dental implants?
Sure. I actually did a 1-year very intense study and training, hands-on training on placing dental implants at the California Implant Institute.
That's the surgical training?
Yes.
Okay.
Pure surgical training, very advanced, training. From that point on, I actually took a bunch of different courses with Nobel Biocare. I've actually had the opportunity of talking to a bunch of other doctors. We've been networking, trying to figure out what's the best way of getting this technology to be the best for our patients.
Is this the future of dentistry, by the way?
Oh,
like
yes.
No more dentures, we said at the beginning of the show?
Yes, this is really the future of dentistry. Today we have dental implants. Maybe in next 100 years, we might be looking at genetics coming into play. And that's one of the other reasons why, I believe in proper research and training.
Okay.
And because of doing all these things, we see that we get proven results.
Okay. Correct me if I'm wrong here. And again, this is not an endorsement for you. But how it's normally done is you go to one dentist that does a surgery.
Yes.
Then you go to another dentist that puts the tooth on top.
Yes.
Right?
Yes. You
do both parts of the procedure in your training.
Yes.
So it seems easier on the patient, obviously. Yeah. But do you have a belief that maybe it's better that you're doing both?
I really,
is it?
Yeah, no, it's a very good question. I really do think that, a lot of times when we understand implantology, which is a science of implants, that we have to understand that it's not just one part of the procedure. It's not just surgery. It's not just taking care of the gums. It's not just putting the crowns on top. It's everything put together. And this is one of the reasons why actually I took this intense training, because I always felt that I could always put crowns on top and I could get the nice results from dental implants that were placed. But now, how about if I place it the way I want it to be placed?
The surgical part. So you
Yes.
learn the surgical part.
Yes, so exactly.
Is
So I
it
could-
cheaper or less expensive to go to a doctor? The fact that you do both?
Yes, it can be. I mean, one of the things is number of visits is reduced. You don't have to go to two different people,
Okay.
and you can see, and you can communicate the results that you're looking for with the patients. One of the things I should also mention is the fact that I've just recently been given a coveted fellowship with the leading implant congress in the world.
Okay.
We're not just talking about top clinicians in this country. We're talking about the world.
Is there that much to learn, by the way? I say this respectfully.
Yes, it is. It's just like being a Alice in Wonderland story. Once you go down the tunnel of learning, it just keeps on continuing, and it's such a wonderful way of getting proven results.
Okay, so no more dentures. We're out of time. Somebody watching this,
Yes.
they have an upper or lower denture, they have a friend, maybe wearing a denture, spouse, partner, whatever. What do you say to them? They're still afraid, and maybe they're skeptical.
Wow. I would tell them one very important thing: know what your options are.
Okay.
Do something. Know what your options are, so you can do something about it.
So you invite them in.
I invite them in. Please come in. Let's have a frank discussion. Do you want to change the way you are right now?
Okay, good. I want to thank you for coming on the show.
Of
Very
course.
good. Very
Thank you.
interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. You could put in Dr. Joshi or Orange County Dental Implants. It'll also pop up there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.